Hi, I'm Justin Riley. Today on Wisconsin Doctors, otolaryngology, sinusitis, and surgeries that are now available at Upland Hills Health in Dodgeville. It's a fascinating topic, and we'll be joined by two very special guests. First, Tina White, Director of Marketing and Community Relations, will talk a little bit about some of the recent recognitions that Upland Hills Health has received. And then we'll together talk with Dr. Jason Eisenberg, who is an ENT doctor, and he's going to talk about some of the advancements in technology that have become available in sinus surgeries and how those advancements and services have recently been brought to Upland Hills Health. It's a great show. I hope you stick around. It's all coming up right here on Wisconsin Doctors. Stay right here. Welcome back to Wisconsin Doctors. Today we are learning about some of the new sinus surgery procedures that are available here at Upland Hills Health in Dodgeville. And I'm joined now by Tina White, who is the Director of Marketing, and Dr. Jason Eisenberg, ear, nose, and throat doctor. Do you like being called that, ear, nose, throat?
Yes, I do.
All right, excellent. Well, welcome, guys. Thanks for having us here.
Yeah, thank you.
Tina, I want to start with you real quick.
Sure.
This is kind of your opportunity to brag a little bit about Upland Hills. So you guys were recently recognized in Beckers Hospital Review. Tell us a little bit about that.
Yeah, we're really excited about it. We just learned about it last week. And Beckers Hospital Review is a leading industry publication. And Upland Hills Health was listed among the top 44 hospitals across the United States for best patient discharge practices.
Oh, wow.
And so basically what that means is they surveyed patients from April of 2014 to May of 2015 and asked them how they felt about the information and the education that they received before they were sent home from the hospital. And so we're ranking amongst the top 44 in the United States, and we're very proud of that. And the interesting thing about it is that since 2014, we've actually taken on some additional measures, such as follow-up phone calls, to try to improve that process even more. So we're hoping to climb the list.
Absolutely. And you guys do such a great job of educating your patients. I'm always so impressed with all the supports that are in place, that patients have those resources that they have when they leave and before they come in to see you guys. So that's awesome. So lots going on at Upland Hills.
There is a lot going on. We, over the last year, things have been changing just regularly. And so everyone at Upland Hills Health has been working really hard to continue to provide great care to our communities. And just to highlight some of those things, last year we converted to the EPIC Electronic Health Information Management System. And that's going smoothly. And last year we opened a clinic in Mount Horeb, in the Mount Horeb community. So we're really excited about being able to serve that community. And then also too, we have always had a clinic in Highland. We have for several years, but we're building a new clinic building there now.
Oh, great.
And we expect that to open in the spring.
Okay.
So watch for the open house announcement for that. And then also too, I think announcing for the first time here today, over the last year we've been studying our facility, our campus in Dodgeville, and looking at the age of some of the buildings and patient conveniences. I think there's a remodel on our horizon.
Well,
so,
excellent, excellent. And when I walk in there, that's kind of interesting because when I walk in there, it already seems to be, it doesn't seem like an old building, but that's great that you're already keeping things up to date and everything
Yes, we want to stay current, and we want to continually improve patient access to make it easier and more stress-free for patients.
Absolutely. Do you guys have any new physicians that are coming on board?
We do. We have several new physicians that have already started. Last year, Dr. Maria Sangren, an OBGYN, she joined us, and she's working through the Mount Horeb Clinic. She also sees patients in Dodgeville, too, though. And then she was joined by family medicine physician Dr. Joseph Berg. He also works in Mount Horeb. Dr. Rachel Hartline is a family medicine physician. She also does obstetrics and is certified for C-sections. And she's working out of our Spring Green Clinic right now.
Excellent.
And then also too, we hired Heather Clarson, a hospitalist. So she is working at our hospital in Dodgeville in the evenings. We have brought on board a number of nurse practitioners and CMAs, certified medical assistants, into our clinics to bolster those teams. And I'm really excited to say that we've just recently hired a third OBGYN, Dr. Timothy Rakeley, and he will be joining us this summer.
Excellent, excellent. A lot of new folks there, and a lot of those folks we've had on the show before.
Yeah,
So
yeah.
very cool. We just have a few seconds left, but can you tell us in your own words where you think Upland Hills really shines?
Okay. I really encourage everyone to go on our website and look at the broad range of services that we provide, because I think that that's where we shine. As a rural hospital, you really can turn to us for the majority of healthcare needs that you'll need throughout your entire life. And I'm especially proud of the surgical services and the surgical staff, which is why I invited Dr. Eisenberg to be on the show today.
Excellent. Well, we got to take a short break, but when we come back, we'll be talking with Dr. Jason Eisenberg. Don't go away. There's more Wisconsin Doctors coming up right after this. Stick around. Hey folks, welcome back to Wisconsin Doctors, and today we are learning about some of the new types of sinus surgeries that are available at Upland Hills Health in Dodgeville. And with me is Tina White, Director of Public Relations, or Media Relations, am I right?
Marketing and Community Relations,
there you go.
right.
And Dr. Jason Eisenberg, ENT, thanks for joining us again.
Thank you.
And Tina, you and I are kind of co-hosting today,
Sure,
sort of. So you want to get started? You want to give Dr. Eisenberg the third degree here today?
You bet. Dr. Eisenberg, first I want to thank you for joining us today.
My pleasure.
Will you come to Upland Hills Health once a week on Tuesdays? And you're a Dean specialist. So please tell us a little bit about how long you've been with Dean and your background, how you came to this.
Sure. I started with Dean in 2010. Prior to that, I was practicing in Iron Mountain, Michigan for a couple of years at a fairly rural hospital up there as well. And so when I came to Dean in 2010, I started traveling down to Dodgeville once a week and seeing patients in Dodgeville once a week. And continue to do that.
Yeah.
Excellent, excellent. And what? Talk to us a little bit about your education. Where'd you go to school? Where'd you get your degrees from?
So I went to undergraduate at Loyola University in Chicago, and then I did graduate school and medical school at Indiana University in Indianapolis, and then I did my residency training at UW Hospital here in Madison.
Oh, okay. All right, great. So you've got some roots here in Wisconsin prior to going to Iron Mountain, Michigan, then.
I did, yeah. It was where I had done my training, so it's starting to become more rooted in Wisconsin.
Yeah,
yes,
absolutely.
What led you into this particular field? You know, what about it interests you?
One of the things that I think attracted to me or appealed to me about ear, nose, and throat is the breadth and the scope of the problems that we face with patients. Most of those are related to quality of life issues. Hearing, smell, breathing issues, and so those kinds of problems are ones that would have a lot of reward for patients and for the people taking care of them when you can help them with those.
Absolutely. And now I've referred to you up until this point as ear, nose, and throat doctor, ENT. But is that part of the broader spectrum of otolaryngology? Talk to us about what that specifically means, otolaryngology.
So otolaryngology is ears, nose, and throat. It's just a little easier to say ears, nose, and throat, and so most people wind up saying that. And so the spectrum of things that ear, nose, and throat doctors take care of are obviously the ears, the nose, and the throat, but also related to the head and the neck, surgery in the head and neck, throat cancers, thyroid problems, problems with salivary glands. All of those things kind of fall into the practice of ears, nose, and throat.
And you work pretty closely with audiologists as well, who are working with patients who have hearing loss.
Yes, we do. And so And now more than ever, hearing loss is becoming a bigger issue for us.
Yeah, absolutely. Yeah. So talk to us about just a little bit about you, and we got to take a short break after that, but what sorts of things do you do in your spare time?
Sure. I, along with my wife, help take care of our 3 children, and they keep us pretty busy. So I guess that's a lot of what I do.
Yeah.
That's it. You don't have to say anything more. That's fine.
Right. No more time for anything else.
I do like to play golf, and I play soccer, and so I like to be outdoors and be active that way.
Excellent.
Yeah.
Well, it's warming up, so I hope you get a chance to get outdoors and enjoy the weather.
Looking forward to it.
We got to take a short break. When we come back, we'll talk more with Dr. Jason Eisenberg about some of the specific surgery options that are available at Upland Hills Health. We'll be right back with more Wisconsin Doctors. Welcome back to Wisconsin Doctors, and we are learning about otolaryngology, sinusitis, and surgery options that are available at Upland Hills Health. Tina White, who is the Director of Marketing, is with me, and we are talking with Dr. Jason Eisenberg, who is an ENT specialist here. And Dr. Eisenberg, we've learned a little bit about what you do, when you see patients and so forth. Let's talk a little bit about the difficulties that a lot of folks have with sinus, or people with sinus issues face. How would you define acute sinusitis versus chronic sinusitis? I've heard both terms used. What's the difference?
So sinusitis is an inflammatory process of the sinuses, and it can be either an acute process, which would by definition probably be less than 3 weeks of duration, or it can be more of a chronic process, which would be several months in duration. And it's an important distinction in terms of management of patients and what kinds of treatment options that you offer them. And so patients will show up with symptoms, and part of trying to figure out what their symptoms, if their symptoms are consistent with that, is how long they've been present, and determining which direction to go from there.
Sure, absolutely.
What are the challenges to diagnosing? Is it a difficult thing to diagnose?
Seemingly it can be. Sinusitis is kind of a masquerader. There are a lot of other issues that can go on that can cause symptoms that can be confused for sinusitis, and so a lot of diligent history taking, and sometimes detailed examination with either endoscopic examination in the office or imaging studies like CT scans can sometimes help to delineate what those symptoms are attributable to.
So I'm gonna throw a curveball at you real quick here, because I know that you can answer it. But a lot of folks, when they come in, they say, I think I have a sinus infection. Can I get antibiotics? And what they're told oftentimes is, well, it's probably a virus. This is probably viral. Right. Do you think that there's a distinction in there that people who get perceive that they're getting sinus infections are actually getting a bacterial infection that's treatable with antibiotics? I mean, is that something that you experience?
We do sometimes experience that. I think that that has been an interesting transition. That in April of 2015, the American Academy of Ear, Nose, and Throat released a clinical practice guideline for managing acute sinusitis, and one of the strong recommendations was that you manage the inflammatory component of the process, and so that involves using things like nasal sprays and nasal rinses on a regular basis, not just once in a while.
Not just when you're getting the symptoms.
Right, and then the use of antibiotics is actually starting to fall out of favor with acute sinusitis. There's been a lot of information looking at patients at 7 to 10 days after the onset of the illness. Only 4% of people who get antibiotics actually had improvement as a result of the antibiotics. And so really that shift is more over toward the inflammatory part.
Yeah, just managing those inflammatory
Managing
symptoms.
the symptoms,
Yeah,
exactly.
Absolutely.
And then from there, trying to prevent them from coming back.
Right, yeah, absolutely. So you talked about how to prevent some of the ways you can manage the inflammatory. As I've heard, manage the inflammation, manage the drainage. You can manage your infections and so forth. What are some other ways that people can treat? How is the actual, when it gets to that point where, we can't prevent this now, it's happening right now, what are some ways that you can treat sinusitis?
So oftentimes it's looking for underlying medical conditions that can be leading to recurrent sinus infections.
Sure.
So allergic patients will be more prone to having sinus infections. And so managing those underlying medical issues, but I view using things like nasal sprays and nasal rinses as kind of like the apple a day. So
Yeah, sure.
it's the apple a day to keep the sinus doctor away, so
Yeah.
to speak. And when that fails,
Right.
if and when that fails, then there are other options available. So patients that have recurrent acute sinus infections will sometimes have sinus operations to make those daily treatments more effective in the future.
Absolutely. Yeah.
Dr. Eisenberg, let's tell the viewers again how often you come to Dodgeville.
Sure.
And then another question that I had was, what's the age range that these issues typically affect an individual?
So I come to Dodgeville every Tuesday, and I've been doing that now for the last couple of years. The age range of patients that I see just in general in the office is infants to end of life. And so it's one of the things that I enjoy about my specialty is I get to see patients across all age ranges. And as a result, I do see children with sinus problems and older folks with sinus problems as well. And so unfortunately, sinusitis doesn't discriminate the different age groups.
Yeah.
It can affect anybody, and it's a very common reason for visits to doctors' offices.
And really quick before we go, where all do you perform your sinus surgeries?
So historically, they've really only been performed in Madison, and a lot of that had to do with technology that was available to make operations safer and outcomes improved for patients. But now that technology has become available at Upland Hills, and so we've started doing that since the first of the year at Upland Hills.
Excellent. And when we come back from break, we're going to talk a little bit more about what that technology is right here with Wisconsin doctors. Don't go away. And welcome back to Wisconsin Doctors. We've been talking about the sinus surgery options that are now newly available at Upland Hills Health in Dodgeville. And I'm joined by Tina White, Director of Marketing, and we've been talking with Dr. Jason Eisenberg, ENT doctor. And Dr. Eisenberg, I think a lot of folks who might be watching right now are thinking about, they know somebody who's had sinus surgery in the past. They know about how there's a pretty long recovery process to that, or there has been traditionally. But there's some new technology out there that you guys can offer to folks who are thinking about sinus surgery at Upland Hills Health. How has that technology changed the patient experience?
Sure, I think that's a very good question. One of the things that patients will often say to me when they're contemplating sinus surgery is they're concerned about a recovery process that may be prolonged or painful. And a lot of that is, I think, based on some of the historical way in which sinus surgery had been performed and before some of the newer technology became available. Under very, very rare circumstances would anybody have sinus surgery where they had any kind of what we call external approach, where there's any scars or marks on the face or any bruising or anything like that. Traditionally now is done with cameras through the nose or endoscopically. And so I think that in and of itself has been a dramatic improvement in terms of recovery rates. However, additional recoveries and additional improvements have come in terms of the way in which we manage the packing of the nose afterwards, which
Sure,
I hear
right.
stories, of my dad had surgery 30 years ago and they pulled 6 feet of gauze out of each side of his nose, and you're not doing that to me. And I can respect that and see how that would be pretty uncomfortable.
Right.
Now we're using more kind of dissolvable packing, which is cleaned out of the nose as it dissolves, but also on postoperative visits is usually removed with suctioning. We also use some implants in the nose that help to kind of hold things open, so we don't have to plant or put packing in there to hold things open. And the newer implants now, or in particular a newer implant, will dissolve steroid in the nose, which will allow the patient to have that decreased inflammation during their recovery and improve their outcome surgically. It tends to keep patients off of steroids, which has been one of the mainstays of treatment after surgery.
Right, yeah.
Great. I know that I was having a conversation with Brad Jebbia, our surgical director, recently, and he said that, at Upland Hills Health, we don't bring on new services until we know we can do it really well. And so you've been performing surgeries at Upland Hills Health since January. Tell me about that new technology and some of the new techniques you're able to provide.
So I mentioned a little bit of that. The Upland Hills is invested in what's called an image guidance sinus surgery or navigation, which allows the surgeon to take the sinus anatomy that he or she knows and marry it to the imaging study, the CT scan that a patient has had done preoperatively. And so when an instrument goes in the nose, not only can you see visually where it is, but you can see on the CT scan where the instrument is specifically in the sinus anatomy. And that gives patients gives an extra level of safety to the operation itself. And so that piece of equipment has kind of been a very important step in terms of the presence of sinus surgery at Upland Hills. Additionally, they brought in other types of, as a result, have brought in other types of things that we use for managing patients, as I had mentioned, with different types of packing materials post-operatively. And in patients that it's appropriate, we use the steroid-eluting stents, or we use dissolvable packing and those kinds of things to really improve that post-operative experience for patients. And as a result, most patients will describe about a week where they feel really congested and kind of like they have a bad cold. A few patients will have some discomfort, but surprisingly, not as much as one would think. Many patients say they took a few pain pills post-operatively, but after that they realized that they really didn't need that. So those kinds of technology advances have been very helpful for improving safety, improving the recovery, and then also improving the outcomes. So when we add in all that together, it really makes it a nice combination.
And no more 6 feet of gauze coming out of each nostril, so that's always a positive.
I would say that's pretty rare to hear about.
Right.
At least now, yeah.
Right. So, before we go, we just have a few seconds left, but I think it's important for viewers to know that, we've been talking a lot about how far sinus surgeries have come, even in the past few years, especially at Upland Hills. But I think it's important for viewers to know that sinus surgery is not the silver bullet or the magic solution that cures everything. They still have to do things afterwards to manage their congestion and manage their inflammation and so forth.
Exactly, that's a very good point. We do sinus surgery on patients primarily with recurrent acute sinus disease or patients with chronic sinus disease. All of those are patients who have failed medical treatments leading up to the operation.
Right.
And so the design or the desire of the operation is to make it so that those sinus cavities are now available or more acceptable to medical treatments. And those medical treatments generally go in the way of topical treatments.
Dr. Jason Eisenberg is here at Upland Hills Health on Tuesdays, working with patients on their ears, nose, and throats. So thank you so much for joining us today, Dr. Eisenberg.
Thank you.
It was a pleasure. And Tina, I got to tell you, I enjoyed hosting with you today.
Thank
Thanks
you.
for joining us.
I enjoyed it too. Thank you.
And that's all the time we have for Wisconsin Doctors. From all of us here at Channel 57, we're inviting you to live longer, live better. We'll see you next time.